Find that leadership, my NHS career, everything was quite traditional in the scope of pure innovation. The NHS had the opportunity to be more flexible for patient care. The predominant leadership style for myself,
whatever your manager tells you, that's your rule book.
When it comes to really key decision making, because not everything is going to work when it comes to NHS.
We as a leader give autonomous everyone.
You have to learn when to stand up, to make a point, and when not to. It comes from that entrepreneurial spirit. Essential success to change management is communication.
What is your take on that?
Welcome to Keep It Moving podcast. Today, I have a great guest, Onos. He is an entrepreneur, but happened to be in the healthcare industry. And he's very close to London. He's working for a primary care trust in London. And he has a wealth of knowledge in developing businesses and supporting small businesses to deliver amazing services to the National Health Service. He's an entrepreneur in his own rights, and fantastic conversation we are going to have. Let's dive into it. Onos, thank you very much for joining me on this podcast today.
My pleasure. Thanks for having me, Xavier.
Amazing, man. The point we want to discuss about is all about leadership, and also leadership in the health industry, which we are all operating out of.
Yeah.
And you are entrepreneur in your own rights, and at the same time, you are serving the most incredible organization on the land in National Health Service. And how do you balance it out? And what are the leadership challenges you would get across?
Yeah, no, that's a brilliant first question. You've hit me with a good one. So it's funny because I find that my leadership style has changed, particularly in that when I first started in my NHS career, everything was quite traditional. And so it was very much just having to go line by line, just kind of follow the rules, so to speak. But now we're in the scope of pure innovation. Yeah, NHS.
Brilliant there.
And so there's this need to use your autonomy in a much more creative way. And so I find that with my capacity now across the borough I'm working for, I have this opportunity to be more flexible with the commissioning body. I have the opportunity to be more flexible with practice partners, have the opportunity to be more flexible for patient care. And so the predominant leadership style for myself has been one that is very open, one that's been very transparent, and one that puts communication at the forefront because of this evolving world that we're going into and evolving world that we're already in. It's benefited me, particularly with the number of staff that I have. So particularly in the capacity I'm in,
yes,
I'm managing about 51, 52 staff.
Oh my God, you are a busy boy.
It can obviously take its toll, but because of that kind of vast number of employees, you do need to ensure that you know what's going on the ground,
yes,
as much as you know what's happening in the ICB world, right? And so I just find that there's a need to have these touch points with all of them periodically when I can, to make sure that I am understanding what the pressures are on the ground, which is where that openness comes in, transparency comes in, and so on and so forth. Once I understand the pressures on the ground, then I can start to feed that back to the decision makers.
Stakeholders.
Absolutely, to the stakeholders, and then we can get to a resolve or a solution or an innovative change that can make things better.
You know, when Onos talks about the traditional leadership style, I think you're referring to the leadership style in the past in the health industry was whatever your manager tells you, that's your rule book, you just follow it.
Absolutely.
Nowadays, we as a leader give autonomous ability to every one of us so that we can be as innovative as possible, communicate with everybody so that we get the best for the organization we work for, at the same time for the patient group we serve, isn't it?
Absolutely. So if you take the additional roles, for example, that have now been instated for a number of years in general practice, each of them, because of this scope of innovation, have autonomy to be their own independent practitioner of some sort, independent clinician of some sort, and that puts the onus and responsibility on them to make sure that they're trained well, to make sure that they understand the system, to make sure that they understand the patient list size that they're working for in a much greater way than it had been maybe a number of years ago, where again they just had to follow this kind of tick box exercise in practice. I just see this amount of people do this and then that's that. But now they need to think, okay, as much as I've done this on paper, how can I better produce patient outcomes for the practice or for the PCN as a whole? So it's a different world.
It is. Have you anytime noticed the entrepreneur owners jumping into action while you're working in your NHS capacity?
So yes, most assuredly. I find that I have to put on my entrepreneur hat when it comes to really key decision making, because not everything is going to work. When it comes to NHS, not because you may not want it to work, but because they don't have the necessary infrastructure to make it work. A big part of being an entrepreneur is to create your own path. If it's not there, you have to make it.
You need to make
And so that's a big part of what I find myself doing. Okay, I can see that as part of this infrastructure, there's not this particular gap to make this happen, or there's not this gap to make things work better, right? And to how to make things more efficient, how to operationalize things better. So then you just have to take a bit of strategic time away from the business as usual to actually just think. You know what I mean? To just think and strategize and come up with a solution that has not been seen before. And sometimes that can come with its own sense of resistance, right? So at the moment, as you know, I manage 4 PCNs that come with 4 independent individual clinical directors. I have their own 4 individual thoughts and opinions and such. And so when you do want to do something new, an entrepreneurial way in this NHS framework, it does come with the resistance of those more traditional views. It does come with the resistance of not seeing this before.
But again, we are in a very lovely situation where, in the olden days, the entrepreneurial thought process never been invited or entertained in the National Health Service. Currently, you are the man on the ground, seeing a problem before it becomes a problem, and fixing it before it becomes an issue, and sorting out the workforce, being innovatively thinking and creating so much value for your job role, and which directly reflect on patient care. This is amazing thing what we are facing, and I'm sure you will enjoy that part of it very much than a traditional role, isn't it?
Yeah, absolutely. So you made a good point about value.
Yes.
Being an entrepreneur is about adding value. And in the scope I'm in, particularly in NHS, I do believe I've been able to add value at that scale. But now I have to think about how I can add value more autonomously as an entrepreneur as well. So it's interesting because there's so many principles as an entrepreneur you can take.
That's what I want to hear.
To so many different things, right? And you just have to take a bit of time to figure out what principles best fit for the context you're in. And I find that particularly with the NHS, the best way to deliver outcomes is simply going to be by building relationships. It's a key part to being an entrepreneur. Networking, ensuring that you've got the right information to have the right conversation, all of that plays a part in the NHS as well, not just at the commissioning level but down to the patient level.
And what are the other values you bring in as an amazing entrepreneur into the National Health Service?
So I would say for myself, I come with a lot of, evidence-backed credibility when it comes to my business now. So when I consult with, particularly in my healthcare clients, they are confident to know that actually I've got a well of experience of understanding a wide system around healthcare. So I can talk to the effects of different conditions. I can talk to the effect of different patient groups. I can talk to what it's like to be on the commissioning side of things from my experience as a commissioner. I can talk to what it's like to speak with heads of primary care, particularly in ICB land. So all of that helps me to bring credibility to my clients and say, actually, I've got the social proof. Actually, I've got the evidence. Actually, I've got the results to be able to tend to what you need.
You know, your journey in this is quite unique, and with the heritage from Nigeria. Take us through the journey, how you proved your leadership skills and also converted yourself from a normal young man to entrepreneur. How did the journey come about?
I would like to say it was organic, but you do have to make some very intentional steps and take some very intentional routes to get to a point of standing confidently as an entrepreneur. There's a key term or common term that's kind of floating around, which is imposter syndrome. And I feel like I still go through that, quite regularly, but you do have to get to a point where you take your experiences, you take your competence, and you land in a place of feeling established as an entrepreneur.
Yes.
And that's where the growth is, and that's where the scale is. My father, he didn't talk much about his entrepreneurial endeavors whilst I was growing up, but I was able to see glimpses of where he was building a few things. Now I can add my experience to what he's sharing with me now that I'm obviously an older person, right? I can add my experience to what he's already put as a foundation, start making things make sense to him. And I find that is, I must have learned some things subconsciously to be able to get to that point.
I think he put the seed in you when you're very, very young. I think the seed is slowly rooting down and growing upward. And you're just seeing the leader out of the blossoms now.
Absolutely. So there's obviously you have to take, my wife says this amazing phrase all the time. When you hear conversation, she says, take the meat, leave the bones. Take the meat, leave the bones. And essentially what that means is take parts of the conversation that add tangible value to yourself and leave the parts that don't. And I'm sure I'm not the only person with a story that says, when it came to growing up, I could see a lot of things that would add value to how I wanted to be, and a lot of things that I wanted to leave behind. And thankfully, when it came to this entrepreneurial journey of mine, there was a lot of things I saw in the way that my father engaged with people, the way he spoke with people, the way he treated the family. I can see that there are certain principles there that I can apply directly to be an entrepreneur. Just things like integrity.
Yes, integrity.
Things like integrity.
Key part in a business.
Absolutely. Things like being on time. Just those small things that I saw. My father, and I don't want to go into a whole biography of who I am, right? But my father was not somebody who spoke much. And again, that's a very key part to entrepreneurship as well, where you have to learn when to say and when not to say. You have to learn when to stand up, to make a point, and when not to, particularly when it comes to the NHS, where there are so many updates coming to you, or so many changes coming to you without your say at times, particularly on the ground. Sometimes you don't have a say to be able to inform on the changes that are happening nationally or at a local level to patient services. So you have to, in particular board meetings, or you have to, in particular network forums, stand up and say, actually, this is what I think is right. Actually, this is what I think the way we should go. All of that, it comes from that entrepreneurial spirit.
Did you find any key challenges when you are growing up? I grew up in India, where my mother tongue was my first language, and I studied till A level in my own mother tongue. So English was my third language, and English was my third language, and I started studying in English from a university level. it was a huge challenge for me to, keep up with every words and talk fluently. And one point I realized communication need to be key. If I want to live and work in England, I need to really get my English to a good standard. And my children still take a mick out on me. Dad, your English is horrible. Your grammar is absolutely out of place. How you get on with it? And I say to her, my children, and say, my people are really kind to me. Have you heard or have you come across with any challenges like this in your journey?
In my journey as an entrepreneur, my journey has been one of sometimes you have to break away from what you're used to, and that's similarly with the situation with the example, right? In terms of the language that had to be learned, you were used to one tongue, and then you had to change it. When I was starting my career, particularly in the NHS, I was a data head. Everything was numbers, everything was analytics. It was profitable for me at the time because, again, with the traditional system, I mean, we're talking about artificial intelligence now. Maybe 12 years ago, that wasn't part of the conversation.
No, not at all.
At all. I found that there was a big window of opportunity for me to be able to scale in my career progression quite easily because of that data skill set that I had. I then realized that still had a ceiling. And that's very much an entrepreneurial idea or thought that comes in, I believe, in every entrepreneur, where they see a certain point and they can start seeing a cap, and they have to figure out, prior to getting to that point, how you break past it. You could see a certain cap of revenue, or you could see a certain cap in profit, and you think, how do I go to the next level? And I started having these kind of conversations with myself when I was a data analyst in the NHS, thinking, how do I go to the next level? It could either be a senior analyst route. I reached that point, then how do I go to the next level? And I realized that the way to really make some fundamental change in the system was to be a key decision maker.
Nailed it, man.
It's the only way to be a key decision maker, and that comes away from the, obviously in my context, the analytics, but more so it comes away from the kind of day-to-day administrative type of responsibilities and functions. It's more about how you're engaging with the people. It's more about how you're engaging with people.
And this is two different it's two sides of the spectrum.
Absolutely.
So one side, you are thinking everything as a data, numbers. But the other side, you need to be full of empathy, consideration for others, and understanding people's problem.
Absolutely.
What is the expectation of the patients and your colleagues?
Absolutely.
It's a huge shift you have made.
It had to be done. And you have to, there's two sides to it. There's one side which is selfish in nature. How do I progress? But then the other side is, how do I make real change? How do I really see, if I'm crunching these numbers and putting them into an Excel spreadsheet, how am I seeing that those numbers are actually having a material effect in the patient population that I'm, serving and referring to? The only way to be able to do that is to be in the room where those conversations are being had. And that's all around service development. It's all around commissioning. It's all around pathways. It's all around treatment, it's all around training when it comes to clinical staff and non-clinical staff. All of that plays a part towards how certain decisions are made for the profit of the local population.
You won't believe this. I think we are in the best moments in the National Health Service, and you and I make a valuable contribution to the National Health Service in terms of building the leadership team within, and also delivering a very valuable service and also innovative service to our client group. I have been working in NHS for a very long time, and I think we are living in one of the best moments there. I'm sure all these leadership skills are making a huge difference in people. Now, I always ask this question to various leaders. You grew up organically as a leader.
Right.
Are you doing enough to develop your own people to come to the level, what are the steps do you take now? Because young people are the next generation leaders.
Yes.
We want them to come out better than us. What other steps are you taking now?
Yeah. So one step is to take a step back, and I explain, when you're at the forefront of an organization and the forefront of a team, it's very easy to lead with your own view.
Yes.
It's very easy to lead in your own bubble, because you are confident in what you can deliver. You have to be able to take a step back in order for other people to have the same journey you've had. You have to take a step back and allow them to contribute to the conversation.
Absolutely.
Surprisingly, and I say this to my consulting clients, there's only a few simple steps that you can make. One of them is a regular team meeting. It sounds so small, but let me be more specific. A regular team meeting where you say less and the team say more.
So be a listener rather than speaker.
Because oftentimes you can have a team meeting where you're giving a presentation when you're supposed to be doing it as a team, right? But a regular team meeting where you're intentionally taking the time to be more silent, going around the room, ensuring that everybody not just can give you an overview of what their work plan is or what their workload is, but actually sharing their ideas on that actual workload as well. That will give them the drive. That will give them the opportunity as well to be able to start thinking about their own work, to start thinking about their own journey and thinking about their own remit. Once they get into that space, then that's kind of the trigger for them to start going forward.
I really like the way you think that, you're taking a step back and let people to visualize their own dreams and where they want to head to, where they want to be, and then guiding them and, mentoring them to achieve it. That's amazing view you are taking. That's great. And I love that, actually, and we do mentor lots of our colleagues in our own business. But sometimes, we do feel that we are buying people into our own vision. But at the same time, I want to let them explore their own journey, their own vision, and move towards it too.
Yeah.
And, the next thing I want to talk about, the National Health Services is facing lots of criticism in the media, which I do not agree most of the time. Yes, National Health Service could do far better for the people. I think we are doing all of our best there.
Yeah.
And do you think the AI coming into play and loads of innovative ideas floating around, how or what the National Health Service could do more to meet the needs of our own population?
It's a brilliant question. So the rise of AI, I think the biggest drawback I've seen with the news, just collectively, really globally around AI, is this fear that people have.
Yes.
This fear that people have about their jobs, this fear that people have about the work that they're doing. Surprisingly, in the healthcare space, particularly around the NHS, I find that people are seeing AI more of a productive tool.
Perfect.
More as a constructive tool than one that's going to be damaging to their careers. And this is both clinical staff and non-clinical staff as well. So I think the NHS could do a little bit more in alleviating people of their fears. In primary care, there's what you call a patient participation group.
Yes.
And I would really invite any of the, as we said, NHS key holders and NHS decision makers, key stakeholders, I would really invite for them to come to the ground a bit more.
Yes.
And start bringing to those particular meetings, and even to primary care network meetings and such, informing patients, informing staff at the ground level to let them know that this isn't going to be something damaging to you. It's not going to be something damaging to your career, particularly for the staff. for the patients to let them know it won't be something damaging to their health, because there's still a distrust around removing your traditional patient to GP connection. There's still that distrust in the NHS. It just takes, and I know it sounds like something I'm banging on about, Xavier, but I just find the central point of all change and the central success to change management is communication.
Again, people who are listening to this or watching it on a YouTube or somewhere, AI is everywhere, whether we like it or not, it is there. And many people fear, as you rightly said, Google is taking over everything. Microsoft is taking over everything. Americans are listening to what I'm saying. Actually, no. These are all algorithms and codings, which really give so much information, which helps us to understand, comprehend far many things in a better way. And we use AI in our own practice, and it's mainly leveraging a human effort so that automate many things which we don't need to do, every mundane activities. That gives the time for another person to develop in themselves or do something productive for the team what we are working.
Exactly.
And the primary care network where we are all serving at the moment, it's doing an amazing job. Do you see any huge changes going to happen in 2025, 2026 going forward? Because this is a very innovative idea. At the same time, it's a very cost-effective model for the National Health Service.
Yeah.
What is your take on that?
We've done a lot. There's a lot. There's a lot to probably go through here. But for a number of years, I find that primary care networks have had to mature. I think particularly in this year, we've seen that settling across primary care networks, across their workforce, across understanding their patient population. I think the next step for primary care networks is for them to be at the center of neighborhood working. Because there's still this disconnect between primary care and secondary care. To some degree, some may perceive it as a rivalry of some sorts between the two, but actually we are all to serve one purpose, and there needs to be a mediation. With that comes from the commissioning level to bring those two sectors together and then create a joint solution. It may be that we need to focus on one particular program, that could be vaccinations, for example, or it could be physiotherapy. But if we take one common project, one common source that affects both sectors, and find a joint solution where both primary care and secondary care staff can benefit from it, and also patients can benefit from it, then I think that's a way to move forward for next year. Without that, they're still going to be independent. They're still going to be moving in silo.
Yes. That means, you're doing everything on your own. There is a complete disconnect between the two organizations. That wouldn't work well.
Yeah.
Let me put this question to you hypothetically, okay?
Okay.
I'm not saying you're going to be in politics next week. Hypothetically, if we make you as a health secretary for a month, what would you do for our amazing National Health Service?
What brilliant question.
This is a hypothetical question.
Wow.
You don't need to really, but I know how you think, and you will come out with at least 4 or 5 ideas here. I'm sure, man.
I would say, well, first of all, I would apportion funding appropriately. As first of all, and then that's not to say that a bad job is being done. I just think that more due diligence can be done in order to create a funding framework that actually is sustainable. We've seen some brilliant steps as far as additional roles are concerned, brilliant steps as far as development across general practice is concerned, even funding at a local level for those digital innovative tools and creating a digital infrastructure at primary care level. The problem and the question that's being asked is, how long is this going to last? There doesn't seem like there's an assurance of
long running
for this to be a long-term solution. if I was in that particular seat, as you mentioned, I would communicate a clear track of what this funding looks like for years to come. Giving that sense of confidence to let people know that they can proactively start planning towards their services and start planning towards the future of patient care. When the additional roles scheme came into play, there was still very much the best word I can use, Xavier, is a frenzy towards how we use these roles, where do we put these roles, what patient groups should they serve. And it was only because the proactivity that they needed to have, or the information they needed to have to be proactive, wasn't there. Again, it all drills down back to communication. If I was in that space or in that seat,
Communicated very effectively to the American networks.
with a good future plan.
Yes.
As to not just a high level agenda as to what needs to be achieved, but an agenda as to how it's going to work as well.
So the first one, proportion of funding, and announce it for long term.
Yes.
What's the second point? You're going to give it to the health secretary.
Interestingly enough, I remember speaking to somebody at a political space, in a political space, about this. I think there does need to be more forums created for contribution, more forums created for the right people to get on the table and speak in a way that's constructive for the country. At the moment, I still feel like those conversations are being held either privately or to some degree secretly. I'm very cognizant of the fact that you can't publicize certain information.
That's true.
For you don't want to fearmonger or anything like that. But I do believe that there are still particular bodies on the table that need to be present, and there needs to be particular heads of departments at primary care level and secondary care level that need to be on the table,
On the conversation point.
need to be in the conversation, because if we don't bridge the gap between the higher people and the lower people, I hate to put it that way, but sometimes that's the way politics look, then there's going to be then that disconnect is still going to exist, and the only way to bridge that gap is for someone to come down and for someone to come up.
Yes.
And it's much easier for someone to come down and have the conversation at that level.
What would you do for workforce? Because we always think our national health could do with more helping hands in workforce. And what would you do as a Secretary of State for a month?
A month is not enough when it comes to workforce. It's not enough. It's not enough. It's really not enough. But actually, I'll take a spin on that, and I may potentially keep things the same. Not because I can't think of any changes to make, but because I don't think any potentially do need to be made as far as workforce benefits are concerned. Still, in the NHS, as much as there is that disgruntled perspective, that you find from the media and such, the NHS is still an organisation that heavily benefits its staff, down to the fundamental point of pensions.
Yes.
NHS staff receive. It still has one of the highest
benefiting one
nationally. That's pretty much incomparable to more of the private organizations across the country. So I think I would sustain things simply because it's working there, and the narrative around salaries for staffing, I believe, don't shoot me down here, but I believe it's it's becoming distasteful, simply because they are comparing it to the level of work that we've had to experience over the last 3-4 years. But lest we forget, we had to overcome a pandemic as well.
Yes, that's the biggest challenge for the national health.
And I guess the plight of healthcare is that it's a very dynamic sector. It's hard to predict where things will land. And so when you are a key worker in that space, you have to build a resilience to say anything can come. And you also have to take, and I follow this through when I have these conversations with my staff around appraisals. You have to have a viewpoint of you can't marry your performance with your salary.
Yes.
Because you lose sight of the essence of what it means to be in healthcare.
Say it again. This is amazing point. So you cannot marry
You can't marry the view of performance with your salary because you lose out on the essence of what it means to be in healthcare.
Wow. That's very good insight. But you need to vocalize it again and again to many people. Yep. Go on.
So it's just really important to kind of elaborate that when you are in an industry as we are in, your primary thoughts are focused on the betterment of the industry, or the betterment of your area, or the betterment of your patient.
Your patient population.
It has to be that. And I'm not saying that people shouldn't be concerned about the living crisis and things of that nature. Absolutely. And employers in this sector, in the healthcare sector, should also be cognizant of that as well.
Absolutely.
They should. But as a worker, I think it's really important to ensure that you don't discredit the benefit that the NHS brings to its workforce because of the demand that you need to meet, because that demand is ever changing.
Yes. You're making a very, very, very good point. It's a job satisfaction when you work in national health, and you are tuned in a way that you are very empathetic towards your client group, and you won't get that in a different professions in a different ways.
Absolutely.
So it's fitting to all the frontline workers. In national health and in business, partnership, networking is the most important thing.
Yeah.
And as a Excel Health being a private organization, at the same time we serve loads of NHS organizations, right from the prisons to local national health trust, and also primary care networks across the country. This is a playground or a ground where not only private companies are contributing to the betterment of the service delivery. There are loads of community interest companies delivering it. Loads of non-profit organizations are delivering amazing job. How important this partnership to last so that we get the best value for the NHS? And also, what would you expect from these organizations in the future going forward to do better?
So, as you said, partnerships are key. Partnerships are key to scaling, key to growth, key to development. There is a need for private organizations to support the NHS, because I think, as I mentioned earlier, the way healthcare is dynamic in nature, and particularly because of the framework that we have in the NHS, there is a propensity for workers to become exhausted, and there is a propensity for workers to become overburdened. That capacity needs to be met, not necessarily through extra recruitment, but it just needs to be met by partnering with particular providers or partnering with particular organizations that are already satisfying that capacity in their local area. Another thing that I'm finding as well, as far as partnerships is concerned, is that some of these private organizations have the training.
Yes.
Some of them have the training pathways necessary to be able to upskill NHS staff. Because most of these private organizations, well, let me not say most, but a lot of these private organizations in the healthcare space are specialists in nature.
That's true.
And they've developed and curated their own training track or training pathways for the staff and workforce that they have. We don't have to have a model that is all or nothing.
Yes.
When you partner with an organization, you can have, I like to say, a Build-A-Bear model, a Lego type model, where you are taking elements or functions of one organization to adopt into your own, simply to improve a particular area
Yes.
of what's needed. And I think in the NHS, training is an area that still needs work. Training is an area that still needs development, and you could simply go to a partner organization to adopt what they've done, adopt the learning that they have embedded in their own private practice, and bring that into the NHS workforce.
That's brilliant, man. That's amazing, because the value the community interest companies and voluntary organizations brings in is amazing for the national health. In my opinion, NHS is leveraging it very, very well. And as a partnership, everybody's doing their best for the betterment of the service we deliver to the client group. That's fantastic. Let me take a couple of questions towards your person because I have a huge respect for you and a admiration towards your leadership skills and the entrepreneurial thought process. But let's get to know Onos as a person. Let me ask you a couple of quick fire questions.
Sure.
Just tell me what comes first to you. Which will be your favorite holiday destination?
Oh gosh, it's got to be one I've been to or one I would like to go.
You would love to go.
Hawaii.
Hawaii?
Yeah.
So you are a warm person then?
I'm definitely a warm person. I'm about to struggle for winter coming up. I'm a warm person. I love the heat. I love the sun. I love relaxing in the heat and the sun. And also, I'm somebody who likes experiences, and I've never experienced being in one of those straw type.
Yeah.
So I love to be in one of those as well.
And who's your favorite author?
It has to be Malcolm Gladwell.
Malcolm Gladwell, the management consultant. I think I've read 2 books from him. He's an American, I believe, isn't it? Is that right?
Yeah.
Malcolm Gladwell. Yes.
So one of the books that I believe really changed me was Outliers.
Outliers. Yes, I read that.
It completely shifted everything I thought about life and about how to not necessarily leave things to chance, but to trust that things have been set up in a way because of your environment and your context, and it takes the pressure.
Yes.
Having to, keep pushing and keep trying and keep grafting. Just sit back and allow the dots to align.
Perfect. I love that book as well. I've read it. And what's your favorite meal or cuisine?
It's my favorite cuisine.
Yeah.
You're going to be surprised at this. And you're probably going to shout at me later because it's your therapy. It's chicken and chips. I love chicken and chips. It sounds terrible.
Shouldn't be in London.
I know.
Yeah.
I know. I just really enjoy it. I don't know what to say. Let your dietitian come speak to me later.
You wouldn't believe it. One of my friends been in America for a road trip for 2 months. All he had is chicken and chips.
The fastest, easiest way to eat.
And he's at Kentucky everywhere. Kentucky Fried Chicken everywhere. McD's. That's not the good health you want, but you love it.
Exactly.
Amazing, man. Thank you very much for your time today.
My pleasure.
It's lovely catching up with you. And then I think you're doing an amazing job for the National Health Service.
Thank you.
And I would recommend you to spread your thoughts, all the platforms you actively contribute, LinkedIn and Instagram, everywhere, so that loads of leaders should follow your footsteps.
Thank you so much, Xavier.
Keep up with the good work, man.
I will do.
Thank you very much for your time today.
Thank you, Xavier. Thank you.